Hi, this is Bill. I'm going to be giving you the lecture on the care of client with infectious, inflammatory, and valve disorders of the heart. Okay, so infectious and inflammatory disorders of the heart, they start out with rheumatic fever, rheumatic carditis. Pathophysiology is an etiology. Rheumatic fever follows a group A streptococcal infection, and rheumatic carditis is the inflammation of the cardiac manifestation of rheumatic fever. Rheumatic fever also causes the endocarditis, which is preceded by an inflammation caused by group A beta hemolytic streptococcal pharyngitis. This causes lesions or scarring on the heart valves that lead to deformity of the valve. During the assessment findings, mild fever, rapid heart rate, and abnormal rhythm. Red spotty rash on trunk but disappears quickly and leaves irregular circles on the skin. That is a key point that you're going to need to know. Okay? So please remember that. Diagnostic findings: ESR and EKG, C-reactive protein. Medical surgical management is IV antibiotics, penicillin, vancomycin, or Zithromax. Surgery for corrective pericarditis and damage to the heart valves. They can replace the valves, even on small children, and they just have to keep going back for replacement of those valves until they are up to full size. Aspirin for clot prevention, steroids, prophylactic antibiotics. Nursing management, administer prescribed drug therapy, diversion activities. Bed rest is one of the things that happens to these people, and they need to remain on bed rest. Okay. Infective endocarditis, most common in clients that have a structural malformation. Pathophysiology and etiology is inflammation of the inner lining of the heart tissue, autoimmune response, and more than likely to a group B hemolytic strep. Assessment findings: that you're going to have fever, chills, muscle aches, joint pain. Osler nodes, look that up. It might be on a question. Splinter, hemorrhages, Janeway lesions, Roth spots, petechiae, enlarged spleen, heart murmur. So those are things that you have to look forward to. Question 1: which of the following histories of a client would relate to a diagnostic of bacterial endocarditis? Previous heart catheterization, strep throat 4 weeks earlier, open reduction internal fixation of the left hip last year, and smokes 2 packs of cigarettes a day. Think. Okay, it is the group B. It's B group, strep throat 4 weeks ago. Bacterial endocarditis is generally associated with an upper respiratory infection caused by a streptococcal bacteria. Okay, so those are things you can also look forward to finding out more about, and they more than likely will be on a test in the future. So take time to know those type of things. Diagnostic findings: anemia, leukocytosis, blood cultures, transesophageal echocardiogram, and an EKG. High doses of IV antibiotic therapy, bed rest, and valve replacement can also happen with these people. All right, myocarditis. Myo meaning muscle, carditis meaning heart. So this is the thick layer of the heart itself. You have the endocarditis, which is the inside of the muscle, and you have the pericardium, which is the outside of the muscle. Okay, So you have to look forward to that. Etiology is an inflammation of the muscle layer of the heart, like I was just saying. Viral, bacterial, fungal, or parasite infection. Coxsackie virus, A or B, influenza A or B, virus, measles, mumps, Epstein-Barr virus. Epstein-Barr you'll hear a lot about over the next 6 months. Assessment findings: sharp stabbing or squeezing chest discomfort resembles an MI. Sitting up relieves the pain, low-grade fever, tachycardia, dysrhythmia on an EKG, dyspnea, shortness of breath, fatigue, cyanotic skin, crackles, S3, gallop rhythm. Okay, so that's a different type of rhythm. It's not the lub-dub, it's lub-dub-dub. Okay. Diagnostic findings is you're going to have a white blood count, C-reactive protein, EKG, or ECG, I'm old, chest radiography, endocardiography, and radionuclide, and a biopsy if necessary. Bed rest, sodium restriction diet, and cardiotonic drugs. Digitalis is one of the big ones that they use, and possibly a heart transplant if they cannot correct the problem. Monitor cardiopulmonary status, vital signs, I&O, daily weights, SpO2, and maintains blood O2 saturation. Cardiomyopathy, 3 types. There's dilated cardiomyopathy, hypertrophic cardiomyopathy, and restrictive cardiomyopathy. Pathophysiology: heart muscle loses ability to pump blood effectively. Dilated cardiomyopathy is dyspnea on exertion when lying down, fatigue, leg swelling, and palpitations. Hypertrophic cardiomyopathy leads to syncope, chest pain, may be asymptomatic. They don't even know they have it. And then restrictive cardiomyopathy is external exertional dyspnea, dependent edema in the legs, ascites, and hepatomegaly. Okay, so their heart gets really big. It causes problems, and it causes blood to go back into your liver. Chest x-ray, EKGs, of course, echocardiogram, cardiac MRI, and a cardiac catheterization. Medical: diuretic, digitalis, antihypertensives, antidysrhythmic drugs, anticoagulants, dietary sodium restrictions, and that surgical. You again might put in a pacemaker, a defibrillator, ventriculomyomectomy, transplant. So they actually transplant part of the ventricle of the heart. Medical and family history, physical examination, vital signs, heart sounds, edema, look for edema, abdominal enlargement, SpO2. What is their monitor? Cardiac monitoring, O2 therapy, and emotional support. Okay, pericarditis. Pathophysiology and etiology: inflammation of the pericardium, primary or secondary. Secondary to endocarditis, myocarditis, chest trauma, MI, post-cardiac surgery. Cardiac tamponade, which is caused by pericarditis, and causes the heart muscle to be constricted, and that from excess blood or fibrous fibral attachments that can cause it. You have pulsus paradoxicus. That means that the blood pressure, the space in between the blood pressure readings get longer. Okay, Assessment findings: fever, malaise, heaviness in the chest, pericardial pain, moving and breathing worsens the pain, sitting upright and leaning forward relieves the pain, have a pericardial friction rub, and serves hypotension, severe hypotension, excuse me. Still learning how to operate this machine here. Is an inflammation of the pericardium commonly known follows a respiratory infection, but it can also follow the other things that were listed there above. Okay, diagnostic findings. ST segment on the EKG is elevated, chest radiography, echocardiogram, white blood cell count, and an ESR. Medical: rest, analgesics, antihypertensive, and NSAIDs, and corticosteroids. Surgical is a pericardiocentesis and a pericardiostomy. That's where they actually cut the sac away from the heart. It's not really necessary. A pericardial sac that is out there, and they can do that with very little complications to it. Pain assessment is very important. Auscultating heart sounds, looking for distended jugular veins, persistent cough, dyspnea, fainting, anxiety, changes in pulmonary function. Interventions: monitor for tachycardia, pulsus paradoxicus, neck vein distension, cough, syncope. A lot of the things that you monitor for is the signs and symptoms. Cover site of the pericardiocentesis with a sterile dressing and inspect the dressing for bleeding or leaking fluid. Rationale: compromised skin and underlying tissue creates a potential for a blood or fluid loss, as well as an entry site for microorganisms. Okay, question 2. A patient with pericarditis has been admitted to the cardiac intensive care unit. Nurse is caring for the patient, knows that the most common clinical assessment for pericarditis is what? Select all that apply. You might as well get used to selecting all that apply. Diaphoresis, chest pain, elevated cardiac enzyme, and a friction rub, or all the above. Which one is it? Well, it's all the above. The signs and symptoms of an inflammatory disorder of the heart includes all the following. Other symptoms include arrhythmias, heart murmurs, and cardiac enlargement. Okay, thrombophlebitis. Most people don't associate this with the heart, but if you have a thrombophlebitis, which is a formation of a thrombus, also called a DVT, a deep vein thrombosis, it can cause a pulmonary embolus, a PE. Inner vein is irritated by injury, platelet clumping together, forming a clot. Vicrotriad, venous stasis, altered blood coagulation, and trauma to the vein. That's what the Vicrotriad is. Assessment findings: discomfort is in affected extremity, calf pain that increases on dorsiflexion. This is called the Homan sign. You take and push the foot up towards the shin rapidly, and it causes pain in the leg, in the calf. Heat, redness, and swelling. Capillary refill is less than 2 seconds. Fever, malaise, and fatigue. Diagnostic findings: Doppler ultrasound, venogram, impedance plethysmography. Medical and surgical management. You have medical management, which is ambulation, compression bandages, anticoagulate therapy, Continuous warm, wet packs. It's a little hard to do that when they're laying down, but when they are in bed, you wrap that leg with warm, moist packs. Surgical, you go in and you do a thrombectomy or a ligation of the vein. Okay. History of blood clots, risk factors, obesity, contraception use, Homan sign, pain or tenderness in the calf, capillary refill, and pulmonary embolus, which is chest pain and dyspnea, and a feeling of impending doom, because they all feel that. Okay. So then there is thromboangiitis, which is also known as Berger's disease. Inflammation of the blood vessels associated with clot formation and fibrosis of the blood vessel walls. Cold or numb, burning and tingling in the feet, intermittent claudication, leg cramps after exercise, pain at rest, cyanosis, and redness of the feet and legs. Skin mottled purplish red and appears thin and shiny, sparse hair growth, black feet, and this is what they look like. Tobacco restrictions, because of what does tobacco do? The nicotine causes constriction of the blood vessels. Nursing management, history, pain, increase or decrease, examine extremities, nails, skin, temperature, peripheral pulses, capillary refill. Question 3. Okay, we're getting closer here. A nurse has educated a client on the causes of Berger's disease. Which of the following would indicate the client's understanding of the disease process? Okay. C. The condition is associated with smoking. All right, that's why we tell them to stop smoking, cessation of smoking. Okay, the heart structures. Now we're moving into the heart structures itself. 4 cardiac valves: aortic, mitral, tricuspid, and pulmonic. And you might want to know which ones are which, because I'm going to have you guys put in order the flow of the valves and blood through the heart. Okay, so you need to know this. Structures can be affected by malformations at birth, inflammation, and infectious disorders, age-related degeneration, surgical damage after MI, or injury from intercardiac procedures. Left side of the heart is aortic and mitral valves. Right side of the heart is pulmonic and tricuspid valves. Here is a picture of what it looks like, okay? Aortic stenosis. Now, aortic stenosis is a disease of the aortic valve. 3 cusps or leaflets, narrowing of the opening of the aortic valve cusps become stiff and rigid. Muscular wall or left ventricle enlarges and thickens in response to the stiff calcified valves. Older adults usually are the ones that we see this in. Narrowing of the aortic valve, degenerative changes. Young adults, it's a congenital defect. Other causes: rheumatic carditis and infectious endocarditis, and that. So there's other causes for it. Assessment findings: asymptomatic dyspnea and fatigue during activities, dizziness, fainting, angina. Cardiac pulse feels weak. S2 heart sound is a split, so it's a lub T-dub. Okay, so there's an extra sound in there. It's split. It's not in synchronous. Chest radiography, EKG, ECG, echocardiogram, cardiac catheterizations to find it. Management is usually with digitalis and diuretic, sodium restriction, antibiotics, a balloon valvuloplasty, aortic valve replacement, or transcatheter catheter aortic valve implantation. They've got all kinds of options today. Nursing management, monitor symptoms, explain purpose and techniques of the diagnostic tests, administer prescribed medication, and so on and so forth. Okay? Question 1 for this one. A nurse assessing a client diagnosed with aortic stenosis. On auscultation, the nurse assesses a grade 2 murmur. A description of this heart murmur includes which of the following? Okay. It's C, a very quiet murmur that can be heard when auscultating the heart. The S2 heart sound is split, that is, there is a definite separation between the sounds of the aortic valve and the pulmonic valve closing. Okay. Aortic regurgitation, a little bit different than the stenosis. Pathophysiology and etiology of the aortic valve does not close tightly, and blood can leak backwards. Valvular incompetence causes damage to the valve cusps or papillary muscles. This is one you see in heart attacks sometimes, that they affect the papillary muscles and they don't work correctly. Rheumatic carditis, endocarditis, syphilis, age-related stretching of a proximal aorta, systemic inflammation, and so on and so forth. Also, it's been associated with fin or redux, which were out a long time ago and caused a lot of problems. Assessment findings: tachycardia, skin flushing or moist, water hammered pulse. Systolic blood pressure is high, diastolic blood pressure is low or normal. Heart murmur. First palpitation when lying flat or on the left side. Later stages, dyspnea and chest pain. Medical management, you will take and give them cardiac glycosides, digitalis, or something like that, and then beta blockers, diuretics, prophylactic antibiotics, modified lifestyle, aortic valve replacement, vascular grafts are also there. Nursing management, preparation patient for diagnostic procedures and monitors, response reports changes in heart rate, and blood pressure teaching. Question 2. For which one of the following assessments should the nurse withhold a cardiac glycoside such as digoxin, lanoxin, when caring for a patient with a valvular disorder? And this one should be drilled into your heads. Okay? You must know this one. And it is the client's heart rate is 50 beats per minute. If it is less than 60 or greater than 120, you hold the digitalis and call the physician. Okay? Don't just give it. That's where people die. Mitral stenosis is the same thing as aortic stenosis, but it's on the mitral valve, not the aortic valve. So it's a little bit different. This happens as a sequela to rheumatic carditis. Mitral valve between the left and atrium and left ventricle. It's a bicuspid valve, and it's involved in stroke volume. Causes, like I just said, inflammation, causes thick, rigid, commissary, and incomplete emptying of the atrial emboli can cause that. Pulmonary hypertension, right-sided heart failure. Assessment findings: fatigue, dyspnea after slight exertion, tachydysrhythmias, dyspneic at night, especially when they lay down. First, when they sleep, they find them sleeping in an upright position just to help with the breathing. Diagnostic findings: chest X-ray, esophageal echocardiogram, and EKG. Medical management, antibiotic therapy, preventing or relieving symptoms of heart failure, daily aspirin, anticoagulation, surgical management, commissurotomy, nursing management. You want to take and monitor physical condition diagnostics. May take as long as 20 to 40 years for this issue to show up. So it's not something you get and then you have results tomorrow. Mitral regurgitation, again, it's with the mitral valve. It's the same thing that happens with the aortic valve. It does not stop the blood from going backwards. It's usually impaired myocardial function after an MI, papillary muscles again. Blood flows backwards into the left atrium during ventricular systole and leaks into the left ventricle during atrial diastole. They can lead to cardiogenic shock. Chronic fatigue, dyspnea on exertion, palpitations, S1 heart sound is diminished, hypertension, tachycardia, blowing murmur. So this is one you can hear real well. Diagnostic findings, transthoracic or transesophageal, echocardiogram, chest radiography, angiography, EKGs, angiotensin converting enzymes. Acupril is one of them. Angiotensin receptor blocker like losartan, digitalis, calcium channel blockers, beta blockers, anti-dysrhythmia drugs. There's all kinds of things that they can do for this person. Intra-aortic balloon pump, annuloplasty, and a valve replacement is the other possibilities for this person. Disorders of the mitral valve: monitor your blood pressure, your heart rate, and the rhythm. You can only do rhythm if they are on a monitor. If they're not on a monitor, you cannot do rhythm. You can just describe what the beat is. Assess heart sounds and lung sounds. Report signs of left or right-sided heart failure. And we'll go over that when we discuss heart failures. Education is prophylactic antibiotics. Mitral valve prolapse is another disorder of the mitral valve. Valve cusp enlarged and becomes floppy and bulging backwards into the left atrium. More common in young women than in men. Causes idiopathic, in other words, they don't know why, rheumatic carditis, inherited connective tissue disorder, and coronary artery disease. That's what CAD stands for. Mitral valve prolapse syndrome, autonomic nervous system dysfunction. So this is what it looks like here, and you can see how the blood just flows as it wills. Assessment findings: asymptomatic chest pain, angina onset does not correlate to physical exertion. Duration is prolonged, not easily relieved. Palpitations, fatigue, anxiety, rapid and irregular heart rate, shortness of breath, lightheadedness, difficulty concentrating, click sound during ventricular systole. Diagnostic findings: echocardiogram and EKG. Medical management: antibiotic therapy, digitalis, beta blockers, calcium channel blockers, low dose aspirin, anti-anxiety medication. Why would you want anti-anxiety medication for this person? Think about it. Valve replacement is also the surgical removal of the valve and replacing it. To relieve chest pain, lie flat with legs elevated at 90 degrees. Restrict alcohol, avoid caffeinated beverages. So those people that drink a lot of coffee, guess what? You're going to have to go to decaf. Promote adequate fluid, exercise, and monitoring their blood pressure. Question 3. A client has a possible diagnosis of mitral stenosis. Which of the following symptoms correlate with this diagnosis? Select all that apply. There they are, all 4. Okay, all 3 of them. A, C, and D. The one that does not correlate is the heart failure. Okay? Just the facts. We're done with this one. Put it in the back, okay?